This Focus on Health segment is brought to you by Aurora Healthcare.
Patients dealing with cancer these days have many different treatment options. Hello everyone and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're going to be visiting the Radiation Oncology Department. We're going to sit down and talk to Dr. Michael Hsie about radiation as a treatment option. Well, thank you for joining us today. Today we're talking a little bit about cancer, and we're in one of your treatment rooms. But let's start off by talking a little bit about what cancer is. I think a lot of people hear cancer, but how would you describe cancer?
Yeah. So Ted, cancer is really, it starts when some of your own cells start growing uncontrollably. Your cells normally multiply and die off as the course of your life, as a function of their normal function. For example, breast duct cells, they grow and shrink with a menstrual cycle, with pregnancy, and that's normal, okay? But if something happens, like a genetic mutation happens within those ducts, that cycle is disrupted. Either they start growing uncontrollably, or they grow and they're supposed to shrink and die away, but they don't do that as programmed. And that's when you start to have uncontrollable growth. And when those cells start acquiring more genetic mutations, to start invading deeper into tissues and into blood vessels, which then gives them the potential to spread throughout your body. That's what we call cancer.
Yeah. Are we starting to get a better idea of what's causing cancer?
Cancer, there's a couple ways to really say what causes cancer, right? How do we know what causes anything? One way you can do that is by looking at the patients who get cancer, looking at the patients who don't get cancer, and see what is in common with those two groups. And there are that way you can get a bunch of risk factors. Some people say that risk factors and causes are the same thing. That's not exactly true, in my opinion. There's some risk factors that are so strong, statistically so correlated with cancer, that you can pretty much say that they cause that cancer. For example, smoking and small cell lung cancer. If you don't smoke, you pretty much aren't going to get small cell lung cancer. Really, what I tell patients is life causes cancer.
And when cancer does happen, here at Aurora, you have many different options for treatment. Can you tell us about some of the treatment options you have here?
In general, we break down the classifications of treatment into surgery, radiation, and chemotherapy, okay? From a radiation standpoint, where Aurora is an amazing organization, we have a great staff, we have lots of resources, both with kind of more standard community available forms of radiation, like our linear accelerator here, high energy X-ray treatments that can be shaped in lots of different ways to target the radiation where we need it, where we suspect cancer cells might be. But certainly, all of us play a role, and for each specific cancer in each stage, there's different ways to treat, different doses the surgery is different.
Right,
as well.
and today we're talking about radiation.
Yeah.
How does the radiation actually kill the cancer cells?
We talked about cancer cells being unique from normal cells in the sense that their genome is unstable. They can't really repair their DNA as well. That's why they became cancer in the first place. Well, we can leverage that because since their DNA doesn't repair well, the radiation damages their DNA and also the DNA of normal cells, but the normal cells already have that ability to repair themselves, but the cancer cells don't. So that's selective. Also, it's where we put it. Radiation is X-rays are great in the sense they go where you put it. So you suspect the cancer might be a place, you point the radiation there and not to the critical organs next to it. Those are two ways in which we get some selectivity about it.
Are there other ways that radiation is used here at the clinic?
Well, there's a couple ways that we use radiation. I would say three general classifications how we apply radiation in medicine. One is X-rays. Now, people are pretty familiar with your typical chest X-ray, stuff like that. That machine is a lot smaller than this machine because we have to use a much higher energy of an X-ray. But in general, it's the same classification of energy. It's an X-ray. So X-ray coming from a point external to yourself going through you, that's probably the most common way in which we treat breast cancer, for example, and many other cancers. And there's different ways we can shape it using our software to get a really tight plan. Another way that we use radiation in the clinic is radiation from inside of you. That is, we have a radioisotope. It's basically a radioactive device that goes inside of you in a precise manner. For example, prostate brachytherapy. We treat the prostate by going to the operating room and placing radioactive seeds, filling the prostate up, and that in itself radiates the prostate from the inside. Okay, no x-rays or anything. We can do both for prostate cancer, x-rays or brachytherapy. There's various different ways. You know, in Green Bay we have, I refer patients for internal radiation. It's called a high-dose rate machine. It's a robot that has a source at the end of it, and we put an implant in a patient, and that source goes inside that patient in a very precise and programmed set of steps to shape the radiation that way. That's also internal radiation, where the patient is not radioactive when they go home.
Yeah, we're running a little short on time, but I wanted to ask you how the patients react. Is there a recovery time to radiation?
There is. You know, it depends mostly on where you're radiating, what part of your body is being radiated, and what essential organs are nearby. And that varies a lot from patient to patient. For example, prostate cancer, you can have more bladder problems and rectal problems, that's because where the prostate is. You know.
Sure. Okay, well, we appreciate you taking some time and sharing the information on radiation today.
Okay, thanks a lot, Ted.
If you have any questions regarding the treatment options Dr. Hsie talked about, including radiation, you can get a hold of your primary care provider or give us a call here at Aurora Medical Center at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.